Hey everybody, welcome back to our series on No More Pain. And today we're going to be talking about tennis elbow, or in normal terms, lateral epicondylitis. So muscles on the flexor side of the wrist will attach on the medial side, and muscles for extension of the wrist will attach on the lateral side. So these muscles that attach on the lateral side of the elbow right here is what we call lateral epicondylitis, or tennis elbow, because when you're playing tennis, you typically bring back your wrist a lot and create a lot of wrist extension, which overactivates this. That's where the name came from. But what we know now through a lot of research and science is that lateral epicondylitis, or tennis elbow, obviously the symptoms are here, but a lot of research is showing that to treat this is actually all coming from the scapular stabilizers, specifically serratus anterior and lower trapezius. This is what we've usually used now to treat tennis elbow. Obviously, the easiest way to kind of help immediately is by putting a little bit more pressure on the tendon. So you might see those circular straps that you tighten. That's great because that also kind of puts pressure on the tendon, maybe increases some blood flow. You've seen our episode on percussive therapy devices. The main goal of that is to increase blood flow. So increasing blood flow here is great. But again, at the end of the day, if you want to fully get rid of tendinitis in the elbow, is by understanding where the problem is leading in the scapula. There's a great research article done by Jay Bott and colleagues that looked at scapular stabilizers as a way to treat lateral epicondylitis, and they did a full study over 6 months to a year and found that their patients with lateral epicondylitis, without even touching the elbow, were symptom-free after using a lot of shoulder scapular stabilizer muscles. And we're gonna go over what these exercises are specifically. So if you're thinking that you have this injury, the goal is now to really focus on where your problems are in the shoulder. Rotator cuff, serratus anterior, lower trap, more of the deep intrinsic muscles, not the more global ones like rhomboids and upper trap. We're talking about more of the muscles that are right attached to the bone on the inner layer and not the outer layers. Those are the ones that are going to be really important. And it's not your biceps tendon, it's not your triceps, it's not your deltoids. It's the guys that are underneath all of that that are really contributing to the tendinitis. And typically this is going to be more with people that are overly using their arm, whether that's in some type of rotational sport like tennis itself, volleyball. Golf is more on the inside. We're going to talk about on a different session, but today we're specifically talking about lateral epicondylitis and how to get rid of that, and we'll focus a little bit more on some of the exercises to help treat that. So the first exercise to really focus more on the rotator cuff and the upward rotation of the scapula to kind of help decrease some of the pain that someone might be getting on their lateral epicondylitis is these wall slides. So how you want to set up is first, start about 90-90. You want the wrists further out than the elbows. This will cause external rotation all the way down into here. Keeping the forearm against the wall, you're gonna slide the whole arm up. Good, and back down. So by doing this, you're really focusing a lot on the rotator cuff, which again is the muscle group closest to the shoulder joint. They might be losing that wrist angle, so you want to really focus on getting the wrist out. So this next exercise is really a full body one as well. We're gonna have the person squat against the wall, making sure the back stays flat all the way. And what we're gonna do is, again, if you can get your arm all the way against the wall there, and then you're gonna slide up and down, keeping the back flat all the way through, rib cage down. Really, again, focusing on, this is gonna help lower trap as you're kind of coming up, rotator cuff as you're moving through the motion here. Again, maintaining the external rotation throughout the whole movement. So the next exercise is a scap push or a push-up plus, specifically targeting the serratus anterior. So what you want to do is keep the elbows in full extension the whole time. And what you're going to do is dip down through your chest and then really come out and really push through so you get that full protraction of the scapula. And then to make it a little bit more difficult, you increase the angles of the hands. So now the angle of the serratus is working at a different position here, going down and back up, making sure you relax the upper trapezius. All it is serratus anterior going in and out there. And again, changing the angle a little bit more, back and forth through there, really focusing on full upward rotation when you're coming out of it. This is the main part of the exercise right there. So you're dipping down, relaxing, and then full contraction of the serratus anterior. Again, focusing a little bit more proximally, not so much distally in terms of wanting to get rid of it for long term. If you're thinking about just immediate effects, think about some heat, some pressure, some stretching to that area, but long-term relief will be from the scapular stabilizers. Thank you for watching another segment of No More Pain on the topic of tennis elbow. Don't forget to like and subscribe to our page and write a comment if you've suffered from this before and what you've found to be very helpful. Thank you very much.